What I am saying is that the healthcare priority, for example, in the city that the Premier's visited today, in Ottawa, where we are, I was told that after only 7 minutes this morning, a testing facility had to close down because they had already reached the capacity for the day. So this is a real and pressing concern for Canadians, the healthcare capacity to test people for COVID-19. That is, for example, a very important priority when we talk to the premiers about healthcare, certainly in the context of a global pandemic. I know my colleague, Chrystia Freeland, and obviously the Prime Minister are reflecting on exactly what these kind of requests mean in terms of the government's financial capacity. We have said we will stop at nothing to ensure the safety and security of Canadians in the context of the COVID-19 pandemic. That remains our priority. That's why we have allocated billions of dollars of healthcare money for provinces and territories, specifically focused on public health measures, protecting Canadians in the context of COVID-19, and we'll continue to do absolutely everything that's necessary in that regard. But the priority that premiers attach to an accessible, high-quality healthcare system is one that we share. And as I said in my opening comments, I'm a great example of somebody who's benefited in an extraordinary way from a remarkable healthcare system in Canada. So we want every Canadian to continue to have access to these very therapies and hundreds of thousands of others. Obviously, I'm not a doctor. But we do recognize that this is of critical importance to Canadians, and that's why we're always available to talk to the provinces about that very issue.